Welcome to the hot seat. If you're a medical or anatomy student, there is absolutely nothing quite as nerve-wracking or, honestly, as thrilling as the anatomy Viva. It's that intense, face-to-face oral exam where it's just you, a professor, and literally the entire human body to discuss. So for today's explainer, we're going to turn this into your very own mock Viva. I'll be playing the role of that stern examiner trying to trip you up, but hey, don't worry, I'll also step in as your supportive mentor to guarantee you know exactly how to nail these questions. So take a deep breath, focus in, and let's get ready to pass this exam.
Okay, let's dive right into this. Here is the strict exam syllabus your examiner is going to grill you on today. Classifying joints, fibrous joints, primary cartilaginous, and finally, secondary cartilaginous joints.
All right, round one, classifying joints, structure versus function.
Candidate, the examiner asks, voice completely devoid of emotion, how are joints classified structurally and functionally? Now, take a second, let that pregnant pause hang in the air for a bit. Sweating yet? Well, don't worry, I've got you. When the examiner hits you with a two-part foundational question like this, they're looking for absolute precision. They want to know you truly understand the difference between what a joint is physically made of and how it actually behaves.
Here's your perfect answer. You look them dead in the eye and say, structurally, joints are classified by their binding tissue into fibrous, cartilaginous, and synovial joints. Functionally, they're classified by movement. Synorthrosis, which are immovable, amphiarthrosis, slightly movable, and diarthrosis, freely movable. Boom. Just like that, you've shown the examiner you understand the anatomy's architecture on one hand and its biomechanics on the other.
Okay, you survived round one. Let's drill down into some anatomical specifics. Section 2, fibrous joints, focusing on that lack of a joint cavity.
The examiner fires off the next question sharply. Define a fibrous joint and list its three types. In Viva, these rapid-fire, multi-part questions are really designed to test your recall speed under pressure. You've got to have a crisp, concise definition ready to go, followed immediately by a mental checklist of the types.
So here's exactly what you say for full marks. A fibrous joint is a joint in which bones are united by fibrous connective tissue. But wait, do not stop there. The absolute key phrase the examiner is dying to hear, the one that earns you that silent nod of approval, is that there is no joint cavity. The total absence of a synovial cavity is the defining feature here.
Then, without missing a single beat, you hit them with the three types. Keep this mental checklist locked and loaded. Sutures, syndesmosis, and gymphosis. Say them with absolute confidence. Sutures lock the bones of your skull together, right? But the examiner knows that's the easy one, so they are definitely going to push you on the other two. Right on cue, the examiner leans in across the table, going full Socratic method on you to narrow the focus. Very well. What is a syndesmosis? And give me a specific anatomical example.
You answer smoothly. A syndesmosis is a fibrous joint where bones are connected by a ligament or an interosseous membrane. And for your example, you give them the inferior tibiofibular joint, that vital connection right down by the ankle. Citing the inferior tibiofibular joint instead of just mumbling between the leg bones is exactly how you score those major bonus points and prove your clinical knowledge in a Viva.
The examiner doesn't even crack a smile, just moves straight to the next quickfire question on the docket. And what is a gymphosis? Keep your momentum high here. You are completely in control of this exam.
Now, what's so fascinating about a gymphosis is the highly specific imagery it evokes. It is a peg and socket fibrous joint between a tooth and its alveolus, or socket. It's such a uniquely specialized joint. Literally, it's the roots of your teeth hammered into the jawbone, held super tight by the periodontal ligament so it can withstand the immense force of chewing. Nailing that peg and socket terminology shows some real anatomical flair.
Moving right along, Section 3, primary cartilaginous joints, also known as synchondroses. The professor hits you with a classic two-part terminology trap. What is another anatomical name for a primary cartilaginous joint, and precisely what type of cartilage is present within it? See, they want to know if you actually know the Greek-derived terms, not just the basic English ones.
You deliver exactly what they're hunting for. The alias for a primary cartilaginous joint is a synchondrosis. And the tissue? It features hyaline cartilage. Hyaline actually means glass-like, referring to its smooth, pearly appearance. Getting both synchondrosis and hyaline in the exact same breath demonstrates you've definitely moved way beyond the beginner textbooks.
Following up immediately, the examiner probes deeper to ensure you actually understand the physiology here, not just the names. Are these primary cartilaginous joints usually temporary or permanent? Provide examples to justify your answer.
You answer loud and clear. They are usually temporary. Why? Well, because they're essentially designed to allow bones to grow. You anchor this fact with the perfect example, the epiphyseal growth plate. This is the hyaline cartilage in kids that eventually ossifies into solid bone once they're done growing. And if they push for another example, throw in the first sternocostal joint, where your first rib meets the sternum, as a great example that sometimes actually persists.
The finish line is totally in sight now. Section 4, secondary cartilaginous joints or symphysis.
The examiner asks for the exact same parameters as the last round, but this time for the secondary classification. What is another name for a secondary cartilaginous joint? And detailed the cartilage present. Sounds simple enough, right? But this is exactly where students tend to mix up their primary and secondary tissues. But you don't flinch. You state that the alternate name is a symphysis. So the crucial point here is how you describe the cartilage. It's not just one type. A symphysis features a tough pad of fibrocartilage sandwiched firmly between bone surfaces that are covered by hyaline cartilage. It's a complex, shock-absorbing sandwich, really, and detailing those specific layers is what earns you the top marks. We are almost done. The examiner gives a slight, almost imperceptible nod and asks a straightforward wrap-up question. Can you give examples of these secondary cartilaginous joints? You lock in the final anatomical examples to complete this symphysis profile. The pubic symphysis in the pelvis, and the intervertebral joints between the vertebral bodies in your spine. A really great mental trick here is remembering that secondary cartilaginous joints, or symphyses, are almost exclusively found right in the midline of the human body. Now, let's see how all this builds into the ultimate examiner trap, the classic compare and contrast question. If they ask you to compare the two side by side, here's your cheat sheet. Primary cartilaginous, known as synchondrosis, made of pure hyaline cartilage and usually temporary, like a growth plate. Secondary cartilaginous, known as a symphysis, featuring that fibrocartilage sandwich, permanent, and located in the midline like your intervertebral discs. Contrasting them directly like this makes it practically impossible to confuse them. And just like that, the examiner finally puts their pen down. You survived the hot seat. Stepping out of the examiner persona for a second, I just want to congratulate you. You've mastered structural versus functional, the three types of fibrous joints, and you've perfectly contrasted primary and secondary cartilaginous joints. So I leave you with this final thought. Having systematically broken down the very architecture that holds the human body together, how will you use this knowledge to absolutely crush your actual Viva? Thanks so much for joining me on this explainer, and happy studying.